Today, the topic of our webinar is Mastering OET Writing. So, before proceeding, I would like to introduce myself. I'm Dr. Maryam Zulfiqar, OET mentor at MedExam Expert. So, let us start our today's webinar, and I'm happy to see a lot of participation. So, I really hope that you guys may get benefit from today's webinar. So, before proceeding, I just would like to just give a brief introduction of the OET exam because I know that you all might be knowing better than me because you are in this phase, but still, I think if there is anybody new here who is new to this exam, then I think it is beneficial for him or her as well. So we know that OET is occupational English test, and we have to take this exam if we are eager to start our healthcare career in international setup. So the thing is, a lot of countries are accepting this exam, and this is the basic requirement to enter in the international healthcare system. So that's why I know that all of you are in this struggle, and I really wish that you all ace this exam, and you may see your dream come true. So let's start. And backend team, kindly proceed to the next slide. So this is the basic introduction of the OET writing module. So we know that for time allocation for the OET writing is 45 minutes. Okay. And these are not the complete 45 minutes. These are just 40 minutes for the letter writing. As we know that there are 5 minutes for the understanding and the 40 minutes for the letter writing. And these 5 minutes are not for you to just waste these 5 minutes. It is for you to properly understand the writing task. So first thing which is advisable is you have to see the writing instructions, like what is given. Moreover, there comes a question a lot of aspirants ask, like, okay, Dr. Maryam, can you please tell us that we have to write one letter or we have to write 2 or 3 letters? So let me tell you, you have to write only one letter. Okay. And we know that in OET letter writing, there are 4 kinds of letters, which are referrals, discharge, transfer, and the emergency referral letter. Okay. So it is upon your luck. You can get any kind of letter. I know that among these 4 kinds, some letters are a little bit difficult and some are the easiest one. So definitely it depends upon your luck. But still, if you get a difficult letter, then you are lucky enough to score highest in OET writing, because the thing is, letter is difficult, and if you are proper understanding of it, then definitely your score and your rank will go higher among all candidates. So it is advisable to have proper understanding of the writing module and all other modules as well before appearing in the exam. So I was just saying that you have to invest those 5 minutes in reading the writing instruction. If you are very keenly and thoroughly reading your instructions, then I'm sure you can get 70% of the idea, like what you are going to write in your OET letter writing. Okay. So writing instruction is the very helpful thing, and you can easily get an idea. Okay, in this letter, these case notes are given. So if I'm going to write these lines, then I would be the relevant one. So you have to read it again and again. And the better thing is, you can in your mind, you can just highlight the things you are going to write. In that way, your 5 minutes are over, and you are just an rough image in your mind, like what you are going to write. So just focus on the task in that 5 minutes. When 5 minutes are over and the invigilation team is going to allow you for letter writing, then what you are going to do? First of all, you have to cover your address and salutation part. So this is the basic thing, which is the doctor details, doctor name, address of the doctor's practice, and today's date, patient name, date of birth, and definitely the greetings. So in this way, your address and salutation is done, and this is nothing new. Like, you don't have to see here and there for writing down the address and salutation, because it is right in front of you, and you are just going to copy paste the things. So the thing is, it is very very easy, but make sure that you must be aware of proper pattern, like how you are going to write address and salutation. Then there comes a date. Okay, so there is another debate, because a lot of aspirants do what? They used to collect material from many sources, and then they are going to jot down their letter together, and then they think that, okay, now it is good because I have collected material from many sources, and then the result is a total failure. So this is very very important point. A lot of students don't know how to write a date, like what is the acceptable and the most appreciated way of writing a date. So definitely it matters a lot. If you're not going to pay heed to writing a date, definitely it gives a negative impression. So this is the first part of your letter. Like, if you're going to write address and salutations, then you are going to write date, patient details, dear doctor, whatever the name of the doctor is. And it is advisable to write surname of the doctor. I can give you example, like if the doctor name is Dr. Hopkins Collins, then what you are going to write, dear Dr. Collins, not dear Dr. Hopkins, because it is advisable to call the doctor by the second name or the surname. So you are going to write dear Dr. Collins. So please, next slide. So now, after address and salutation, there comes the body of the letter. And it is very 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 important thing to consider, because we have to start body of the letter from the thing which is purpose. Let me tell you, in OET exam, purpose of the letter is very very important thing, because if you are not going to pay heed to this thing, you are not going to ace this module. I can give you example like that. If your address and salutation is written good, every other detail is good, grammar mistake is not present, any other thing is not present, like there is no mistake, but still purpose is not written accurately in the letter, you are going to score 290 or 300, and definitely it is C or C plus. So I think now you may understand the importance and the significance of purpose in OET letter writing. You have to start the body of the letter from the purpose of the letter, and the purpose of the letter should be accurately written. And definitely our core students know how to write a beautiful purpose. Okay, so if your purpose is written accurate, then surely you score grade B, and if there is no other grammatical mistake and the format of the letter is also correct. So if you are going to write the purpose of the letter very accurately, then if the letter is also having some minor grammatical mistakes and some other mistakes as well, still you can pass this exam. So I'm just telling you these things because I just want to get you familiar with the significance of purpose. So as we are talking about purpose, I would like to say that in OET letter writing, purpose of the letter is very important thing which decides your fate, like if you are going to pass this exam or not. So there is definitely a proper structure and proper things which you have to write in the purpose. And if you are not going to follow this thing, then definitely your exam is total waste. Even for my practice, when I am going to assess the letters, and if I think that purpose of the letter is not accurate, then definitely those students couldn't get grade B. So after purpose, there should organization of case notes in the paragraph, and approximately 4 and 5 paragraphs are sufficient. Students think that if they are going to write a letter of around 2 to 3 pages, then they can pass their exam. No, it is not true. If you are going to do this, definitely you are going to fail this exam. And some students think that, okay, sorry, we have to write less, and if I'm going to write just little bit of details, then I'm going to pass this exam. No, it is definitely not true. So what you are going to write is your letter must be comprising of 4 or 5 paragraphs. These are sufficient, and each paragraph must be having 3 or 4 lines. If you are going to write in this way, definitely your word count would be in normal range, which is given for the range of 180 to 200. And students ask me, like, how can we keep our word count in normal range? So this is the thing. In this way, you can keep your word count in normal range. If your paragraphs are 4 to 5 in numbers, and each paragraph is having 4 to 5, sorry, 3 to 4 lines. And at the end of the letter, greeting is must think, like yours sincerely, or yours faithfully. And definitely there comes another rule, like where you have to write yours sincerely and where you have to write yours faithfully. So these are the things in OET letter writing. If you are not going, uh, if you are not having proper understanding, if you are not going to pay heed, if you are not familiar with these things, then definitely writing module is the toughest one. I'm not saying it is the easiest one. I was just saying that it is the easy, with the condition you must be having proper understanding. And once you have proper understanding, then I'm sure that it is most easiest subtest in the OET exam. So back end team, please, next slide. Okay, so now we will talk about the format of letter. We know that format of the letter is very important thing, and it varies from letter to letter, as there are 4 kinds of letter. I told you this thing. If you are not going to adopt a proper format, then definitely you are not going to succeed. I told you there are 4 kind of letter, which are simple referral, urgent referral, discharge, and transfer. So if you are having on the exam day, like you are going to write a letter on discharge letter, and you are not following the accurate pattern, like which paragraph and how you can organize paragraphs accordingly, according to the nature of letter, then definitely you are not going to pass this exam. But the thing is, if you are having proper understanding, then it would be very, very easy for you. Okay, you will going to write a letter. I am going to write a discharge letter, and I have to write this thing. So definitely you are going to write, okay, I know that this paragraph would come first and this would come second. So it would be easy for you. So the format of the letter is very important thing, and you have to be very particular about this thing. So all 4 letters show somewhat different format of organization of paragraphs, and it is essential to understand the proper format. Okay, so I'm just saying about the categorization of the letters. So there is an other letter which comes with the name of update letter, and sometimes candidates get confused. Like they ask most of the time in the our course student as well, and they ask like, we have never heard about this letter, but on the exam day we got this letter. So these are the things, these all the things happen to the candidates when they are just searching for the online free material, and they are not going to pay for the course or any other authentic source for the preparation. So these are the things, those happen to those students. Okay, and my advice for all the student is this: I'm not saying you all for paying the course and to get proper guidance. But my point of view is, if you think that you are very serious and you have to see your dream come true, I would advise you, please stick to one source only for the preparation. Because moving here and there, it is not a recommended advice, in my opinion. Okay. So please be stick to one source of preparation. I think this would benefit you rather than searching for here and there, because a lot of students do these things, and that definitely result in their failure. So now there comes word count, and we know that word count command is another important thing, and we have to follow this thing strictly. because definitely it gives a negative impression and you may lose your marks if word count is not within the range given. So we know that in OET letter writing, word count range is 180 to 200. And you have to keep this thing in focus that if your word count is not in the normal limit, then you can be at risk of not acing this exam. So backend team, please, next slide. So there are some of the journal writing tips, and I think you all should follow these tips. And by following and adopting these steps, you can see a better change in your preparation towards the exam. So practice at least 30 letters before your exam, because I know that if you are going to appear in this exam, you make sure that you must be having margin of around 1 and 1.5 month. So if you are having this time, it is ideal time for the preparation of this exam. Most of the students think that, okay, I am having 3 to 4 months, then I can appear in OET. Trust me, if you are going to have this thought and if you think that you can ace this exam by having 3 to 4 months preparation time, then definitely you can never ace this exam, because definitely times move on and you are standing at the same place um, you are on the day of booking. Anyhow, I was just telling you, practice at least 30 letters before your exam and write the letter with stopwatch on. Okay, it is a good practice. If you are going to write rough or at home for practice, it is advisable that you always have your timer or your stopwatch on. After writing each letter, get it checked from the credible source, and definitely med exam expert is the better choice. But still, it's up to you. But I'm just saying that it's up to you from wherever you are taking guidance. But if you are going to write a letter and you are not going for its evaluation, then it is total waste, because you are not knowing like you are standing on which level. Backend team, please, a previous slide, because I'm not done with it. Thank you. So learn from your mistakes and improve. Once you get evaluation and feedback of your letter, it is advisable that you learn your mistake and you are not going to do these mistakes again. Because in our course, I sometimes when we are going for the live assessment, I used to advise my student that, okay, your letter is not that good and you have to rewrite. And trust me, when they are going to rewrite that letter without having the same mistake, it is very, very good impression. So if you feel like you are struggling OET writing, please do not hesitate to ask for help. Get your letters checked and get feedback. I am just repeating it. It's better to seek help than appearing in OET again. So it is another important point. If you are investing such a huge amount on your exam, then it is advisable that you should get proper like I would say proper orientation session and proper guidance sessions for your preparation as well. Do not write rough, only focus on your original letter. Writing is after listening and reading, and you are super exhausted after these two subtests, because I know that these are too much energy absorber. So you would be having 40 minutes for the letter writing, and you have to be both brain and eye open for this module. Consider this subtest the most challenging, but still, I would say it is the most easiest one. So now, these are some of the tips regarding letter writing. And I think I would now go for the assessment part, as we announced that we will be doing assessment in our live session, live webinar. And we have selected 2 letters, and I hope both of the candidates would be with us. So we have shared the case notes as well. So I would like to tell you that what is the criteria of evaluation of OET letter writing. Okay. Please. Okay. So all the question answer session would be at end. If you guys have any queries, you can ask me. You are more than welcome to ask. But still, after the assessment is over, then we will go for the question answer session. And definitely, it is my favorite session to do. So, okay. So now comes to the assessment part. Can you please show the case notes? Backend team, I would request. Can you please show the case notes on the slide if possible, so that we can get an idea like what we have to do in this letter? Okay, thank you, Ramesh. So you all may be seeing that case notes are in front of you, and these are the case notes for the medicine, OET medicine. So all the doctors, please pay your attention here. And I'm going to assess the letter for the OET medicine first, and then I will be assessing the second letter, which is from OET nursing. So please pay your attention here. So you are a GP in Newtown City Clinic. Mrs. Karen Smith is patient of your journal practice. Okay, so this is the first line. And the writing task is saying, using the information given in the case notes, write a letter of referral to Dr. Parker. Address the letter to Dr. Grace Parker, consultant neurologist, Newtown Hospital, Newtown. So definitely it is very, very clear, like you are going to write a referral letter and you are going to write Dr. Grace Parker, who is consultant neurologist. Hospital address is Newtown Hospital, and then it is Newtown. Okay. So these are the history, patient details, patient history, family history. Assessment is given, and then on 1st February 1998 visit, then 15/10/2010 visit, and then 11 July 2020 visit. And the plan is refer to neurologist for urgent neurological assessment. So two things are clear by reading the case notes, that you are going to write referral letter, and the second thing is it is urgent referral letter because you are just in need of urgent assessment of the patient. So now, Ramesh, can you please show me the letter of Dr. Nidhi, who has submitted the letter at first in our OET free group. So I'm going to read Dr. Nidhi's letter in front of all of you, and let's see how she has written the letter. We are going to select the letters from our OET free group. And you all know that on every Friday there is letter writing activity. And I have shared the case notes. And from that case notes and from that letters, because we are going to assess first 5 letters on every Friday. So Dr. Nidhi letter is the first one, and I'm going to give it a read. And definitely I'm going to give her a score and the grade as well. So this is the letter right in front of all of you. Now you may see that Dr. Grace Parker, consultant neurologist, Newtown Hospital, Newtown. Very good. Then she has written date, which is 11 July 2020. I was saying you that there is a definite pattern of the letter writing date. And this is the most acceptable pattern of date writing. Dear Dr. Parker, very good. You have to write RE, not RG. Okay? Like you are going to write regarding which patient. It means regarding. RE. Mrs. Karen Smith, date of birth is this. This to refer Mrs. Smith, who has right eye ptosis, for your urgent assessment and further management. Your help in this regard is appreciated. Okay. I'm sorry. Dr. Nidhi, it is good, but still there is a more acceptable way of writing and starting the purpose of the letter, which is, I would like to refer Mrs. Smith, who has right eye ptosis. Your urgent assessment and further treatment of the patient would be highly appreciated. Full stop. In this way, your purpose is done. And if you are going to write a purpose like this, then you are definitely going to score 3 out of 3 or 2 out of 3 in your purpose, because we know that letter writing is done upon many aspects. It is not only the grammar, it is not only the format. We have to check for many things, and definitely every factor carries different marks. So the purpose of the letter is having 3 marks, and if you are going to get 2 out of 3 or 3 out of 3, then there is no danger, because definitely you are going to perform well in other sections of the factors as well. So Mrs. Smith presented in my clinic today. So there you can write today, and you have to write date as well. Today, 11 July 2020, Mrs. Smith presented with blurred vision since 3 days and serve bifrontal headache 5 to 7. Moreover, she is not able to move right eye and notices more pain while movement and has double vision in both eyes. On examination, her vitals are okay. There is right ptosis but no protrusion. Moreover, speech is clear and fluent. Her sensations, power, and reflexes also normal. There is also no sign of infection. In past, she followed with me for headaches, which was suspected to be migraine, but her symptoms improved with ibuprofen, and also had history of depression, which was treated. Her depression got worse in 10 years back when her medication Zoloft dose was increased. She is medical receptionist and has family. Drinks alcohol occasionally but does not smoke and has no allergies. Your neurological assessment is needed for Mrs. Smith. In case of any query, feel free to contact me. Yours sincerely, Doctor. Okay, Dr. Nidhi, your sentence formation is good, but still I'm going to tell you, you have to write your letter in the past tense, not in the present tense. Moreover, you all may see that if she's going to write one visit in 2 different paragraphs, and it is not making a sense. If you are going to split your paragraphs like the visits in 2 different paragraphs, then you're not having a very good impression. Moreover, for the past social and family history, she has written it down in the very last paragraph, right, like combining the history of the previous visit. So it is also a blunder. So definitely, by seeing the look of the letter, it looks very nice, but still, it is not good letter. I must say this thing. So, but the purpose of the letter is conveying a right message. So I can give her 340, which is grade C plus, but still there are a number of mistakes in this letter. So definitely this is not the pass one. So upon these aspects, we are going to categorize the student's failure and the student's pass ratio. So this is the thing you have to be very careful about. You can see that although it is looking very nice to us, but still this is not pass. This is 340 and it is C plus. So upon these aspects, letter writing assessment is being done. So I think now it must be clear for all of you. So now we are proceeding to the next letter, which is from OET Nursing. And Ramesh, can you please share that letter by, I think the name of the student is Ms. Rani Khatija. Okay. So she has written Mrs. Edith Penny, Community Nurse, Community Health Center. Sorry. You have to put date. Date is 30th April 2017. Dear Mrs. Penny, patient is Miss Sheila Cartwright, age 69-year-old. I am writing to refer Mrs. Cartwright, who is increpating with diabetic foot ulcer. She requiring your continued care and management following her discharge today. So it is good, but try to avoid fancy English in OET letter writing. I would like to tell you, we know that there is an other language test exam which name is IELTS. So IELTS examiners like fancy English, but OET examiner hates fancy English. Okay. So if you are going to write some fancy English and you think that you have to use a very skyrocketing vocabulary, and you think that I would score very good after using this English, these all things apply in IELTS but not in OET exam. So there is a basic difference. OET examiner likes simple words, clear words. Even you can copy paste from the case notes. So it is advisable if you are going to write who is experiencing, who is diagnosed to have, whose signs and symptoms are suggestive of, definitely you can use these simple words. And then Mrs. Cartwright was admitted on 14 April 2017 at Fremont Community Hospital with complaint of infected foot ulcer due to unstable diabetes mellitus. He was prescribed with glibenclamide 5 mg daily and metformin 800 mg TDS. In addition, she was taking Augmentin 125 mg BD. Regarding Ms. Cartwright nursing management, she was monitored for wound margins and signs of complications daily. Saline dressings were applied. She was continued with Augmentin foot. Okay. Next page, please. Regarding Mrs. Cartwright's social history, she lives alone. Small pension. Okay. There was an increase in alcohol consumption, medication compliance since her retirement. It would be appreciated if you could ensure that she is complying with her medication, new diet, and moderate exercise regime. Please suggest an income-producing activity for her. Encourage her in social activities and community social services. If you have any queries, do not hesitate to contact me. Yours sincerely, nurse. So it is good thing, Miss Rani Khatija, this is a very good letter, but please try to avoid fancy English, which you have used in the purpose of the letter. Anyhow, your letter is good and it is B grade and it is 360. So I'm very happy to see that letter. You all may see that sentence formation is very accurate and she has summarized the letter beautifully. So Ramesh, please proceed to the webinar slides. So now I have done with the letter assessment part, and I think it would be easy for all of you now to understand that how do we go for letter assessment in the real exam. So now definitely I think you guys must be waiting for this part, and this is the question answer session. And if you have any discrepancies, if you have any queries, any ambiguities in your mind, please ask me. I'm sorry.
Hello.
Hello.
Hello. Assalamu alaikum, ma'am. Ma'am, I have just one question regarding that urgent letter about the right doses.
Mm-hmm.
Yeah, ma'am, actually in the case note about the previous visit, it is like about 10 to 15 years ago. So it is really, I mean, essential to mention everything from that visit or just important thing?
Just important things.
Okay, ma'am.
Because
so,
these are not the recent ones. So definitely you can skip most of the irrelevant histories.
Okay, so ma'am, is it really important to mention that we have increased the dose up to 20 to 50 mg?
No, if you think that these are the very much old information, then definitely it is not very necessary to write this in the letter. But if it is a recent history, then definitely you are bound to write it.
Okay, ma'am. Yeah, thank you so much.
You're welcome.
Hello, ma'am.
Hello.
Yeah, hello, ma'am.
Hello.
Ma'am, I have a question. In the first writing letter, that the date, which date, first date is written 11th July, and the second is written in numbers, and first written in July, JULY. So these are not the two writing method we are entering in one letter. So is it not better to just write a
these
one?
are not methods. For the address and salutation, when you have to put the main date, so it is advisable to write the month in complete form. But in the body of the letter, when you are summarizing visits, then you can just put down in the numerical form.
Okay. And the second one, ma'am, the first, they start with the urgent assessment and end also with the urgent assessment. So is not a repetition of the words?
No, it is not a repetition.
Okay, thank you.
Okay, so any other question?
Hi, ma'am. I just want to ask two questions regarding this.
Yes,
Actually,
please.
in date, you have mentioned we have to put 11 July. Do we have to put 11th? TH do we have to put, or else just 11 July?
Just 11, just 11.
Okay, thank you, ma'am. And the second question is, in this case note, doctor's case note, do we have to mention the family history here?
Yes, always you have to mention the family history.
No, I'm asking this particular today's case note. They have mentioned
Exactly.
and stroke. Okay.
Exactly, definitely. Whatever the case note says, you always have to write the family history.
Okay, ma'am. Thank you so much.
You're welcome. So, any other question?
Yes, ma'am.
Yes, ma'am, please.
Yes, please.
Which date should we write? The exam date or the date which is given on the case note?
Okay, this is a very good question, and it really depends. If you are having the date in the like the case notes, then it is advisable to write that date. But if the date is not present, then it is advisable to use the exam date.
Thank you.
You're welcome. So, any other
Excuse me,
question?
ma'am.
Yes.
Yes, ma'am. I want
Ma'am,
to, ma'am.
Yes, please, one by one.
Okay.
Everybody
Can
will
I
get
put a
answer.
question?
Yes, please.
Ma'am, suppose we are writing a letter and it is just showing most of the times one visit or two visits, and sometimes
Mm-hmm.
what happens that when we are summarizing the initial visit, it got so much information that the paragraph gets lengthy. I mean, if I'm writing that she presented to me with these complaints and I have to mention, and it took 2 lines, and then I have to mention about the examination and then the pathology results. So can we
Mm-hmm.
split and by ourselves we can make the 2 paragraphs of a single visit, or we just have to make only 1 paragraph for a visit, including all the informations, examination and history and
Okay, I got it. If you think that the paragraph is too much lengthy, then it is advisable that you can just make the complaints in one paragraph and then the examination in the other. Because there is no any other scenario in which the paragraph can be lengthy. Because it is the thing when sometimes they wrote the complaints along with examination, and in this way, paragraph length becomes much more. So it is advisable to write the complaints in one and the examination in the other paragraph. But only in that case. But if you think that paragraph is not that much, it is advisable to complete it in one paragraph. Okay, so any other question? Okay,
Yes,
so
ma'am. Please,
yes, please.
please. Yes, ma'am. In which paragraph, ma'am, we can write social history of patients, like after purpose and initial visit, and after the third paragraph, or any other?
It is advisable to write it at the end of the letter after summarizing all the symptomatic history of the patient. Okay, so it is
Before recommendation, ma'am.
no, before like you have summarized each and everything, and then at the very last you can summarize the social history of the patient. Okay, so now there are some of the queries in the comment box as well. And ma'am, can you please share sample purposes for all the 4 type of letters? So I don't know what is the name Lakshika. Lakshika, it is a very, very like time-taking process, and we have to complete these things in 4 live lectures. So definitely for the webinar, it is not easy for me to summarize all the things. As I told you that our lectures are around 1 and 1.5 hours, and we have to summarize the format of every letter in these lectures. So definitely it is not possible here. And Faizan has shared the link of the WhatsApp group. And I told you that on every Friday, we conduct letter writing activity, and the first 5 letters are being assessed. First 2 letters with the detailed feedback, and the last 3 just only the grade and the score. So, ma'am, can we write social history in which paragraph? I think I have answered it always at the end. Ma'am, comma is important. I mean, we are trying to follow major rules, but not in detail. Yes, definitely. Punctuation marks are of great importance. So we used to learn these things in our basic classes. So I think so. Definitely you guys must be having proper knowledge of it. So these are the things. And let me tell you, we are starting our course on 13th of December. Yeah, this is the date, definitely. So we are starting our course from 13th, and I would like to introduce our course feature, which is 16 live practice session for all 4 modules. I told you that we cover our writing course in 4 session, and it is not only for writing, it is for every other module. So you must be having 16 live sessions for all the OET course. And course content will be provided to you, practice exercises for all the 4 modules. As for writing, I can suggest you better because I'm the writing mentor in the course as well. So my mode of teaching is, whenever I'm finished with the lecture, then we will go for the live assessment. I used to give a task to the student, and then in the other class they submit their task, and we go for live assessment in front of everyone. And the same rules apply for the listening, reading, and the speaking modules as well. So speaking practice with individualized feedback and study room guidance. We have make our study room, and you can get guidance up till exam day, because you are easily allowed to ask any type of question, any confusion in your mind, to any mentor, as mentor are with you. Their mock exam for the final evaluation, access on website for later revision, and 24/7 technical support, easy to follow schedule. So I would like to invite all of you for our course, which is going to start on 13th of December, and I will be happy to see you all there. So if you guys still have any question, please ask me so that we can end the webinar.
Excuse me,
Yes, please.
ma'am. Sometimes after writing the intro, it seems much better. It sounds much better that we write the social history or the family history before starting the letter, like a referral letter. Is it a good approach, or always we try to mention it at the end? Means he's a smoker
Always
and he has
at
a
the end. I
significant
don't know why there is too much discrepancies about this thing, but I always
Good.
advise my students that it must be at the end. It looks very good if you are going to write it at the end of the letter.
Okay. Okay, ma'am. Thank you.
Ma'am, I have a question.
Yes, please.
Ma'am, in referral letter, we will start with the last visit, and all other letters start with the first visit.
No,
I
it
have a confusion.
definitely, yeah, it depends upon the letter type, and it varies from letter to letter. So all the 4 letters are definitely having a different format. So if you are saying that in referral letter you are going to start with the last visit, it is not true. And if you are saying that in all other we have to start with the initial visit, it is definitely not true, because in all 4 letters there are different patterns.
Okay. Thank you, ma'am.
One question, ma'am.
Yes,
Ma'am,
please.
while mentioning the first visit in urgent referral letter,
Mm-hmm.
can we use present tense? I mean, present perfect, or is it preferable to use simple past tense?
You have to use past perfect, but if you are using past tense, then it is also acceptable. But make sure that it must be in past tense.
Okay, ma'am.
Okay, so there are some of the comments in the comment box as well. Okay, let me check here so that we can end the webinar. If date of birth is not mentioned, then how to write the age? Okay, another good point. If date of birth is not mentioned, then yeah, you have to write age. Okay, age 71 years old. Still, if both are present, then you have to choose date of birth, not age. Okay, 29 years old or 29 years old. Before starting paragraph, ma'am, can we write past history at the end? Definitely, you have to write it at the end. And please give an idea about paragraph arrangements. So Fatma, I told you that we have to take 4 sessions for summarizing all these things. So in this webinar, in just 2 to 3 minutes, it is very, very difficult to summarize these things, because you guys cannot get an idea like how you are going to organize. And to be very honest, I would not be the person who would be responsible for your failure in the exam. If I'm going to suggest you, okay, you have to follow this in 2 to 3 minutes, definitely you are not going to properly absorb the information, and it can be result in your failure. So you have to invest a complete time for this understanding, because it is definitely very, very clear if one student is uh, taking around 6 to 7 hours for understanding OET letter writing, and if you are asking me for just understanding for 2 to 3 minutes, definitely it is a big difference. So how to organize a letter? Again, the same question. Can we write the date, which is the last visit, or the day of discharge? No, I told you, if the date is given, better to write this date. If date is not given, then you can choose the exam date. Okay, this was the very last query, and I thank to all of you for your presence, and thank you so much for being a part of this webinar, and I really hope to see you all in the course. So if you guys have any problem, any query, you can ask in our free group, and best of luck for your exam. Thank you so much.
Thank you, ma'am.